My name is Julie Marthaler, and today I'm going to talk to you about data backup and security in healthcare. As most healthcare providers move to electronic health record systems, secure data backup is becoming increasingly more important. Temporary and complete data loss can occur from natural disasters, theft, user error, and drive failure. Data breaches occur when information is not encrypted or when unintentional or intentional access is given to unauthorized users. Most users will not think about possible loss of data or data breaches and direct consequences until it is too late to undo the damages. Therefore, it is often the IT professional's responsibility to make sure weaknesses in the system do not result in data loss. Patient data should be secure, private, and accessed only on a need-to-know basis. The topic of data security is broad, and especially so in healthcare organizations due to the large number of patients, the amount of providers, and staff members who need to see the patient's data, and how information is transported from one healthcare organization to another. Basic data security pertaining to backup in a healthcare organization boils down to the methods of storage, data encryption, and encryption key access. Backup of EHR systems can range from software sending data to on-site form of media to complete off-site redundancy with immediate failover data access. In many cases, the backup process will be a transparent action that does not affect users' work in the system. This transparency and lack of workflow interruption is the goal of many modern-day backup providers. While it is important to have these qualities in mind, the basic function of a backup is to make sure that the user can restore data that is no longer in its original location. Data backup is defined by Merriam-Webster.com as a copy of computer data as a file or the contents of a hard drive. Early evidence of true data backup can be traced back to punch cards used by IBM in the 1920s. While the invention of punch cards themselves date back to the 18th century, a machine that created punch cards was invented by Herman Hollerith, founder of IBM, in 1881 and used to tabulate census data. Hollerith's invention helped the U.S. Census reduce the time it took to record census data. What took 8 years for the census to tabulate was achieved in only 1 year by Hollerith's punch card system. The punch card system proved to be a prolific and exhaustive means of collecting data for much of the early 20th century. In fact, evidence points to the belief that IBM's punch card system facilitated Hitler's quest to locate and kill Jews and other ethnic groups disfavored by the Nazi regime. Edwin Black, author of IBM and the Holocaust, tells readers that these groups of people were found through census punch cards. Also, IBM punch machines were placed in each major Nazi concentration camp and were used to manage data pertaining to the victims. In the United States, punch cards were used not only for census tabulation but also for programming codes. Programmers would create programs by using 2 sets of punch cards, one with instructions for the program's function and another punched on cards with the program ready to be used. Multiple sets were produced and kept as backups for the original sets of cards. In 1973, programmers at IBM met the needs of programmers to run multiple programs, save source codes, and easily edit source codes by combining a document editing program and a punch card program. With the code sets moved to computers, it was necessary to have a way to process the increased data size and to record the data for later use. In the early 1950s, IBM announced the IBM 726 machine, a tape system that was designed to be used with the data processing program from IBM. This new magnetic tape system recorded data 50 times faster than the punch card system and each tape could contain up to 2 million characters. This technology was groundbreaking during the 1950s and allowed companies to increase their bottom line by lowering staffing needs. Overall, administrators saw a vast improvement on storage of processed data. However, there were disadvantages of using magnetic tape. One of these disadvantages is that magnetic tape is a serial access form of media. Serial access means that it analyzes data on the tape in one-by-one fashion, starting at the beginning of the tape. Therefore, it is difficult to access data in a timely manner for everyday workflows. Another disadvantage is that there is a very high risk of inequality through tape stretching and general exposure of the tape. Magnetic tape drives and plastic cartridges gave way to magnetic hard drive disks in the 1950s. The first magnetic hard disk drive was the 305 RAMAC, which is Random Access Method of Accounting and Control, which was also developed by IBM. Whereas tape drives stored up to 2 million characters, the IBM 305 was capable of storing more than twice that amount. In 1962, Akron Children's Hospital worked directly with IBM to take advantage of the storage capacity offered by the IBM 305. A press release from IBM that year announced research results indicating that the time nurses and doctors spent on documentation would be reduced through the use of the IBM 305. The centralized storage of the patient records facilitated the hospital's need for efficient flow of information by handling patient documentation as well as hospital administrative data processing. Hard drives were very expensive at this time and were used primarily for processing and accessing data. Magnetic tape drives, the technology that was replaced by hard drives, were seen as the solution to archive the hard drive's data for backup purposes. Tape drives were inexpensive, had high capacity, and were becoming more popular throughout corporations. Over 60 years later, tape drives are still popular forms of data backup in many hospitals. This may be due to the fact that a large majority of hospitals are nonprofit organizations with limited budgets. They may have legacy systems that are too expensive to upgrade, and therefore administrators are left with few choices for backup. Another reason hospitals may not change from tapes could be that there are IT professionals who are very familiar with using tape and do not see a reason to switch. While tapes can be a reliable way to restore critical data, it is safe to say that most hospitals would be better off not depending on tape backup for their EHR system. There are too many risks involved. The most significant risk is unencrypted data of patients' identity and health. In a 2011 survey of over 400 IT professionals conducted by Information Week Analytics relayed that more than 50% of businesses failed to encrypt their tape backups. That same year, the Science Applications International Corporation learned firsthand what happens when patient data is compromised. The company failed to encrypt data pertaining to almost 5 million patients stored on tapes that were created over the course of 10 years. Unfortunately, scenarios like this are very common, even though technology achievements today are far more advanced than tape backup. There are many services that range from encrypted hard drives to off-site mirrored servers that provide complete failover capability. While there are many factors to look at when choosing a backup service, the most important questions to ask are, will the data be protected in the event that the media is stolen? And will the data be available in the time of need? Hosted solutions are becoming more popular as health organizations realize the need for EHR systems, yet they cannot or do not want to incur the cost for backing up the data. Regardless of whether the organization's EHR system is physically located on-site or hosted by a cloud service, measures are needed to make sure the data is available when needed and kept secure at all times. Hospital and IT administrators should follow government guidelines for all data processing. The immediate future of backup technology will more than likely not include any traditional tape systems. Organizations new to the act of purchasing or implementing EHR systems will be provided with either the vendor's choice of backup or a solution selected by their IT administrator. Both of these options will likely provide an immediate restoration capability due to the consistent use and need of the electronic record. Undoubtedly, a hospital's use of an electronic health record system will require a reliable data backup. The HITECH Act, signed into law by President Barack Obama, has put into place a strategy to make all healthcare providers aware of the importance of EHR adoption. The HITECH law makes it necessary for healthcare providers to use an EHR system in order to receive Medicare and Medicaid payments. Without a proper backup of the EHR system, health organizations such as hospitals could potentially put their business at risk by not backing up the data that must be submitted for those payments. Another reason hospitals should back up their EHR system is the growing importance of continuity of care. If a healthcare organization relies solely on electronic records for patients without backup, a data loss could result in a gap of patients' health information. For many critically ill patients, any data loss in their record could have astounding impacts on their future care. Considering these reasons to back up patient data, it is surprising that there are currently no government rules regarding what form of encryption or what form of backup should be done at a hospital or any health organization regulated by HIPAA. According to the HIPAA security rule, HIPAA-covered entities will need to identify and protect against reasonably anticipated threats to the security or the integrity of their information. However, the rule is very clear that the covered provider will need to make their own judgments on how data, specifically the EPHI, which is electronic patient health information, should be protected. It is important to look at how certain electronic data is viewed by the government. In different industries, the government has long taken a definitive stand on how data should be stored for future use. One such industry is finance. The SEC announced in 2003 that the final rule on retention of data required accounting firms to keep relevant records for 7 years. In 2003, many firms used tape backup. 7 years of archive tape could mean more cassette tapes and more needed room to store the tapes, depending on the size of the firm. As brokerage firms and many other companies moved to an automatic off-site backup solution, storage of electronic data going back 7 years could be very expensive. However, brokerage firms must comply with these rules or face serious financial and legal complications, so backup has developed into a mandatory practice for financial firms. Similar to brokerage firms, accounting firms have also had to seriously consider electronic backup due to government rules. In 2010, the Internal Revenue Service announced that it would add another layer of audits performed at small accounting firms by examining electronic backup files. A federal judgment of this nature makes the act of backing up exchange financial electronic data very critical. Backing up electronic data is not only seen as a necessary everyday practice for accounting and brokerage firms, it is a practice that is thoroughly researched and regular audits are performed to ensure that data is encrypted and can be retrieved when requested. Unfortunately, the health industry's data use has not been as closely watched until just recently. Critical data breaches and complete loss of patient information are common occurrences. With the government's recently progressive interaction with health organizations' actions and electronic patient information, it is not surprising that a pilot auditing system was put into place in late 2011 to ensure that data is properly maintained. Beginning in 2013, the U.S. Department of Health and Human Services Office for Civil Rights will conduct audits on healthcare providers and other organizations that are seen as covered entities. The audits are centered around HIPAA's 3 rules on privacy, security, and breach notification. Without a secure and reliable backup solution, many healthcare organizations will face significant penalties enforced by the HITECH Act. As seen through time, government bodies have heavy control over an individual's information, whether it is just demographic information or protected health information. The future may hold an uncertainty over how much control the government will have, but nonetheless, HIPAA's auditing program is the healthcare industry's much-needed step in moving forward to protect electronic patient health information. Healthcare providers must protect their patients' data through enforced security measures and encrypted backup.